Hannah, I met you 5 years ago when you were just starting in this practice. A lot's happened. Tell us what's happened.
It's been a really busy 5 years, both professionally and personally for me. I started work here 5 years ago as a salaried GP. I've since become a partner in the practice, which is great. I've also got married and had 2 children, and we've moved house 3 times. So it's been really busy, but really fulfilling.
So how did you approach maternity and returning to work as a doctor?
Well, I came at it from 2 very different stances. The first pregnancy I was actually employed as a salaried doctor, so the terms and conditions of my maternity were very clearly laid out. It enabled us to budget and plan really well and make a really informed decision about how long I was going to be off, which was really helpful. My second lot of maternity leave, I was actually then a partner in the business, which is very different. We work by a partnership agreement, and there are obviously terms and conditions laid out in that also, but really very different to those in the salaried contract. So for us, in terms of budgeting, etc., it meant that I could have much less time second time round, which just needed careful consideration.
Your employers have been excellent. Is that always the case for doctors?
Unfortunately, I don't think it is, and although I've been very fortunate, I know of others who haven't. I think although most of the maternity leave contracts are pretty standard, people do struggle to negotiate return to work conditions, and inevitably lots of women decide that they would like to work less or shorter hours once they've had a baby. And this can be difficult to negotiate, and I can see from both sides why this can be a problem. There are schemes in place to try and aid these kind of workers, and there is a GP retainer scheme which enables women to return up to 4 sessions a week in a protected practice with kind of supervision and without all of the extra kind of contract work, managerial and administrative duties, so they can't go in, do their job, go home, look after their babies. So there are things available, it just needs to be thought through.
Being a GP is a demanding thing on its own, so how do you balance things? What's taken a lower priority for you nowadays?
I think I'm probably the same as most parents when I say that you do for a while, and certainly I have a wide variety of hobbies and interests, but I've had to let some of them slide for the time being. They're things that I know I will pick up again in the future, but obviously my priorities at the moment are my family and my work.
Some people are going to be saying, you're lucky. What's it like for most people, being a medical mum?
I think I am at the at one extreme end of how people are able to manage this, and I am very lucky. I've got lots of friends who still live in the place that we qualified, which was Newcastle, and they didn't move back to the area that their families lived, and they all now have young children, and I hear about the challenges they face on a daily basis, and I think that is probably more the norm. So when their children are in nursery and they're poorly, they actually have to rely on a friendship network to actually help them out, and they have kind of almost a rota basis on which they work. So I think it can be done, and obviously it is done very successfully on many occasions, but it's just perhaps not as easy. Another way that people manage things is to employ a nanny rather than using nursery facilities, which I know one of my colleagues here does. It affords him much more flexibility. If he's running late or if a child's sick, then the nanny is obviously still going to be there. So there are ways around it, but again, it's just something that you have to think through and think out. How's it going to work best for you?
Hannah, you're probably in the best position to know what young people that are thinking about becoming a medical mum, what goes through their minds. So what would you say to those people?
I would say there's 2 main things that cross your mind before you're about to embark on either planning a child pregnancy or embarking on maternity leave. The first thing is the fear of losing all your knowledge, which I remember being absolutely petrified on my first day back after maternity leave. And I think, you know, if you keep in touch with your workplace and keep in touch with what's going on in the medical world, then it really isn't that scary at all, but it feels it at the time. The second thing, and probably the more important thing, is the feeling of guilt that is inevitable, I think, as a working mum, whether that be medical or otherwise. And I think you're always going to grapple with the idea of being able to be a better mum or a better GP. And actually what I've learned is that I can't do both. I can't do both in a 100% fashion. It's just not possible. So the way I look at it now is that, you know, what I need to strive to be is a good enough GP and a good enough mum, and that's fine.
Young people listening to you will have all thoughts in their mind about some of the things they ought to be thinking and planning before they set out. How did you approach it?
I think it's important to be very clear about what your rights are in terms of your contract or partnership agreement. And I think, certainly before even planning my first child, I was fully aware of what my contract entitled me to. Because what you don't want to do is end up, you know, pregnant with a baby and not being happy with those terms. Leaving employment while you're on maternity leave is you know, not something that many people would advise you to do. So it's just being clear about that before you set on that path. And I think it's just being honest and open with your colleagues or employers at every step of the way. And if you are having serious thoughts about decreasing your working hours, changing your working days because of childcare needs, the earlier you can start talking about that and planning it, the better, rather than leaving it until it's the day before you want to come back, because it's logistically difficult but very possible.
You actually became a partner here during your maternity.
Yes.
How did you manage that?
Yeah, well, it was interesting the way it came about. Obviously my maternity leave, at that point I was on a salaried contract, and so we actually worked it, and I think most places would probably work it so that my partnership actually, although the partnership was agreed while I was on maternity leave, the partnership started from the day I returned, because that would be very tricky to plan and sort out. So I would imagine, it's an unusual situation, but I would imagine that that's how most people would go about it.
Did that give you better terms for coming back in terms of your hours?
Well, they needed somebody to replace the outgoing partner that was going to work 6 sessions, which is 3 days, and that's what I wanted to do anyway. So for me, there wasn't too much negotiation involved. But yes, I think if that happened to somebody else, then they would have to negotiate quite heavily at that point and think really carefully about what they wanted to work once the child had been born or once they came back to work. So yeah, it's just, I think being open and communicating about what you need is the most important thing.
So what are the positives about being a GP and also a mum?
I think there's loads of positives, which I probably wasn't aware of before becoming a mother, but certainly in terms of the empathy that you now feel towards other parents bringing their children in. I know what it's like having a child with a temperature of 39 and thinking, I'm sure it's viral, but is it viral? And I know that that's what these parents are going through, so I have a lot more empathy with them. And I think just dealing with the child in front of you, really, when you've got a 2-year-old that loves Peppa Pig, you can talk about Peppa Pig and you have that rapport there. So I think there are lots of benefits from that point of view.
Some nice things, but are there any negatives?
I think I certainly noticed when coming back from maternity leave that I had quite an influx of parents with children. Word gets around, they know that you're a new mum and coming to ask your advice and things about, is this the right type of formula for them to be on, is this a rash or not? And although I actually quite enjoy that side of things, I think you can get on quite a one-track lane for a while.
What happens if your own children aren't well?
I think most medics would agree that it's very, very difficult not to over-medicalise your own children. and you do have to just maintain a sense of pragmatism when they are unwell.
So it is possible for doctors to plan to have a family then?
Of course it's possible, and I think especially in general practice the vast majority of female GPs have families. It's got to be possible, it's got to be supported, so I don't think anybody should have any concerns about that side of things.